Um, Welcome, everyone. My name is Cenk. I'm a faculty member at the School of Computer Science and Mathematics at Marist College. And today I'm going to talk about how much informatics is too much for public health big data, or for shorthand, just the amount of informatics courses needed to train public health professionals or public health informatics professionals or specialists. And similar to as Anne explained, it's based on my observations, based on my experience, and I'm going to explain it, where that comes from. So I guess we'll see. So a brief bio before we start. I'm a computer scientist and engineer. I'm a faculty member, as I've said, at the School of Computer Science and Mathematics. In my previous incarnations, I worked as an application developer, as a DevOps engineer. I worked as an IT manager. I did research in grid and cloud computing for my dissertation work. And then recently, before I joined Marist, I was at an institute at Columbia University called ICAP, where I did research and implementation, development and implementation in public health informatics, and then CDC-funded grant, through a CDC fund grant for about 2 years. So this all comes from that experience. And the content of the paper that we wrote with a colleague were, for a couple of reasons, it only has my name on it for now, but we're planning on expanding it for a journal publication. So hopefully you'll see. That it just identifies this skill gap in public health informatics, again, based on our experience in doing a couple of different projects, research and implementation projects in different parts of the world. And based on this experience and these observations, what we did basically is to look at the amount of informatics courses in leading public health informatics degree programs across the United States. And then we had some summary and observations. So there is this significant need for informatics training. I guess that's a no-brainer. In particular, in public health informatics, the need arises from this routine activity of monitoring and evaluation, which correctly corresponds into quarterly collection of data from any kind of health facility around the world. These are typically, this routine data collection is kind of like the bread and butter of monitoring and evaluation, which is one of the core activities in any public health project, whether it's a research project, if it's an intervention project or implementation project. And typically these are to help deal with certain epidemics or pandemics. You can think of HIV, you can think of Ebola, things like that, either short-term or long-term, reactive or proactive projects. And over, one thing that we've seen was that we have really highly skilled and up to their game epidemiologists or other public health professionals in the field. We have really highly skilled data analysts, statisticians. What we really lacked in terms of skills was this informatics with people from, we consistently had to hire people with computer science background that have no information, no idea about what the public health projects or these intervention programs meant, including me. It took me quite a long time to understand what the real deal is in there. I guess when we looked back at the end of the day of some certain projects, we said that, well, what if we had this person who could close this gap from the public health informatics and the science and technology parts of it. When we say public health informatics in the grand scheme of biomedical informatics, you could just categorize it as basically, the study of bioinformatics focuses on the molecular level of bioorganisms. Medical informatics is about human beings, like patients, right? They go to doctors, they get their treatments, and so on. And the public health informatics look at things at the population level, right? The amount of, is typically, revolves around vaccinations or mass interventions, and an intervention can be a vaccination as well. Things like that looks at the population level, at the percentages to deal with, in particular, most of the time, with epidemics and pandemics. So the institution that I worked for, it provides healthcare about 740 locations worldwide, focuses, initially funded to focus on HIV, now it's actually focusing on different types of epidemics and pandemic diseases as well. It's funded by a special presidential program called PEPFAR that's initiated about 12 years ago. They got recently renewed about 2 years ago, so it's, it's in its second decade. And it works in 20 countries, about 200 health facilities, and every single dot you've seen in the map has some ICAP's flag on it. The institute is called ICAP, Columbia ICAP. And as I've said, basically, we just, they just collect data from there. So it operates under CDC guidelines. There are a couple of different core activities in typical programs, and monitoring and evaluation are, all right, there we go. Monitoring and evaluation are some parts of it. So, oh yes, the monitoring and evaluation is the routine reporting is one of the core activities. Other than that, in the ICAP Informatics team is responsible for building responsive websites, optimized systems, some implementation in the cloud part, building mobile public health applications, doing data analytics, of course in collaboration with data analysts in our team, and maintaining these different mapping systems, GIS systems, to provide visualizations so that at the end of the day, we have these parts of the dashboard elements that provides these graphs or different interpretations of data, that provides maps, and so on. And again, just to correct, we don't build these tools from the ground. They're a number of very highly high quality, open source, community-supported tools in this particular field, but the problem is they come with this, like when you download an open source tool, it's a tool for you to customize it, and the problem is that there is no one with the skills in these typical teams to customize it. They don't even know how to touch it, how to open the box and put it up and running. So this is another example of presenting informatics-related information into higher-level managers, like to basically summarize things that need to be done. And part of the deal here is that there's not a, this is not a really a problem maybe, but when you present this kind of a graph and say that, okay, this is how the data architecture is going to work in this particular project, the expectation is that, okay, can we do it tomorrow? Can we do it next week? No, it takes 6 months. And the problem is that you don't have anyone other than these weirdo computer scientists to explain why it takes 6 months. When they hear it from from their own language, in their own language, it becomes easier, but the problem is that there's no one to explain. There's no one to bridge that gap. Right. So we need people with particular informatics skills, programmers, maybe the first one that comes to your mind. But aside from that, we need system administrators, we need DevOps specialists, people who can orchestrate things on the cloud, right? We need open source enthusiasts who can download the tools, play them around, get their hands dirty, and then say, well, we're going to take this, we're going to take that. And then we need IT managers as well in this particular field. So what we did basically is that, as I've said, we've over and over and over, we've seen that, well, we need these specialized, idealist, unicorns that we need to get, and they're not trained. We actually had a lot of graduate students from one of the Columbia University's master's programs, and that they really helped us. But one of the things that we've seen that, say, we had 10 students, 5 of them really excelled in their job, 5 of them didn't really understand the particular skills, not because they're not really wise or whatnot, but that they're not trained for the particular skills. And the difference we've seen was that the other 5 that really excelled in their tasks had prior, computer science orientation, either in their undergraduate degree, some STEM orientation, or some programming courses. And, there are some different cases as well. But to look at the general picture, what we did was basically look at these different types of graduate programs in public health informatics. These are particularly public health, the programs with the title Public Health Informatics in it. And we looked at the number of credits, different types of programs. There's some certificate programs, some masters, some couple of different orientations as well. And then we broke the courses into particular categories, in 5 particular categories. The core is the core public health informatics courses, including data science. That means any kind of statistics-related background is in the core. That's because of the definition of this particular master's program. Other medical courses is in MAD category. Other informatics courses, any kind of programming courses, any kind of technology-related courses in INF. Any research courses for the master's degree, for other types of courses in RES, and then any kind of other courses. So basically, we broke it down into 5 different courses. This table gives the number of credits in each category compared to the total credits in the second column. And then the second table gives the percentages of pretty much the same thing. It's just converted into percentages. So when we look at this data, we've seen that overall, the core public health courses constitute about half of the credits in these graduate programs. Among the other half, 1/2 of it is medical courses. And interestingly, the informatics courses, aside from the data science focused parts, only constitute about 12% of it. And that was one of the interesting results. But then we looked at it and said, well, this is a plethora of different types of public health informatics, different types of programs. There's certificate programs there. There's some master's programs. There's a postdoctoral special kind of program. So let's just break it down into certificate and non-certificate programs, because typically the certificate programs are really focused on a 1-year time period that's focused on giving you, that's designed on giving you this certain certificate degree. So we broke it down into 2 different main categorizations, the certificate and non-certificate. The one in the red are the certificates that you could see the core and the medical and informatics categories are this 60-20-20 split overall, roughly, in the red bars. And then the non-certificate ones, anything that's not special, that's not focused for a 1-year degree, has this, division of different types of courses around. So what was interesting here was that we had the less than 7.5% informatics courses in non-certificate public health informatics programs, and then less than 17% informatics courses in the certificate programs. Then we said, well, this is all interesting, well and good, but let's look at the different types of, other types of medical informatics or biomedical informatics degrees. So we compared that to bioinformatics certificate programs and some of the leading public health, bioinformatics programs versus public health informatics programs. So we've seen that even though the number of the credits are comparably the same, the percentages greatly differ. And the same thing happened in the medical informatics or general health informatics programs as well. They're focused solely on the certificate programs. They're pretty much the same.
Cenk, a couple of minutes.
Okay. So in conclusion, we basically, I highlighted the need for more informatics courses, and then the next steps for us is to basically focus on core courses that can narrow the skill gap. Try to spend more time, and I understand why, even though the number of credits are the same, the percentages are different in these different types of medical informatics programs, and then suggesting program alternatives for both for certificate, initially for certificate, but both for certificate and non-certificate programs, so that we can have these highly trained individuals in that public health informatics era. Thank you, and I guess if you have any questions, feel free to send me an email, or maybe we have 1 more minute.
Just one question, if there is one.
Thanks.
Okay, thank you then.
Thanks.
Very enlightening, interesting perspective. Thank you.